How do you manage your radial forearm free flap donor site? My name is Amit Kochar. I'm a facial plastic surgeon at Pacific Head and Neck Institute of the Pacific Neuroscience Institute in Santa Monica, California. Today I'll be describing things to do with your radial forearm on your donor site after having a free flap. The radial forearm free flap is one of the most widely used free flaps in all of head and neck reconstruction. We can use it for oral cavity defect, repairing the floor of mouth, the tongue, the cheek, and even the soft palate. We can even use it to reconstruct the throat if the cancer involves the swallowing passage or the airway. Patients will have about 6 by 10 centimeter piece of skin removed from the distal aspect of their arm, typically around where you would wear your watch, on your left or your right arm. We typically use the arm that is your non-dominant hand, so the one that you do not write with. The reason being, your strength will be about 95 to 90% of what it was prior to surgery after the reconstruction is done. In order to do the reconstruction, we make an incision, and usually around an oval shape, in the distal part of the arm, and we extend it all the way up to your elbow joint on the inside. And we do that because we need to take the soft tissue from the arm, but we also need to take an artery and vein, and we like to get as much length as possible. Once that tissue is removed, the arm is closed, and a skin graft is taken from the left thigh, which is used to cover the defect because it can't be closed by itself. There's just too big a defect. That skin graft lies over muscle and tendon, and we place a bolster or a pressure dressing on it for about a week while you're in the hospital recovering. That dressing is removed during your hospitalization, and as long as the skin graft has healed 100%, we usually just cover it with a Vaseline impregnated gauze and wrap it with a gauze wrap or an ACE wrap around your arm, usually for 2 to 3 weeks afterwards. The stitches in the arm usually are absorbable, so you won't have any stitches taken out of the arm, but you may have some staples that are removed, and that is usually done during your hospitalization. During the course of the next few weeks, you'll be continuing to change the dressing by putting Vaseline or the Zeroform or the Vaseline gauze on the skin graft to keep it nice and moist, and you'll wrap it every day to avoid injuring it or having any dust and try to limit the amount of infection. In some cases, the skin graft may not take completely and you may have a little bit of skin graft loss. As long as the tendon is not exposed and the muscle, it's just muscle underneath, it will usually heal fine. If the tendon becomes exposed, we may need to provide some additional wound care, typically in the form of home nursing or someone to come and check on the wound periodically. Usually at about 8 to 12 weeks, the arm is completely healed. However, during the time beforehand, you may start to notice some some pain, some discomfort, and some limited range of motion, which is all normal. If you have significant redness, or if you notice any liquid coming out of it, like purulent drainage or pus, that's a sign that you might have an infection. Though rare, it can happen, and we would need to see you in our office sooner so we can evaluate it. Again, typically by 6 to 12 months, you've regained complete strength in the arm. I've had patients who are musicians, piano players, guitarists, also athletes like golfers, weightlifters, and typically they say they have a 90% recovery to 95% recovery in the affected arm from the free flap. Again, it usually does take about 1 year to have healing completed. There can be some scarring, and if that's the case, we can always do some additional treatments such as laser or steroid injections, which may or may not be covered by insurance afterwards, but those can be discussed at a future date if that issue arises. Thank you very much.